get everything right, they still die. In the end, they always die. It doesn't seem fair. They screwed up somewhere. Quit thinking about it and quit thinking about it. Why are you doing this to me, God? Why am I this messed up? Always seeing this. Can't stop this. I can't do this anymore. I screwed up. Should I just end it?
Are you okay, Dad?
This isn't fair.
My name's Scott Geiselhart. I've been diagnosed with PTSD and depression 4 years ago. I'm a firefighter for 22 years. As a firefighter, we went out on a lot of bad car accidents, and we used the jaws of life to cut people out of cars. And as a firefighter, I was taught that we're going to see these scenes, and it's okay to feel things, but we didn't cause the accident, so it's not anything we should be concerned about as far as letting it get personal. Well, it started getting personal when I started having nightmares and flashbacks and anger, and I was drinking a lot. And I actually ended up turning to meth as a coping mechanism so I wouldn't go to sleep and have the nightmares. In this video, it kind of shows a little bit of what was going through my head after seeing these scenes, the flashbacks and the images that would remind me of some of the scenes we've seen. They played over and over and over in my head, and anxiety built, and the tears would come, and I'd even have to pull over. After one of these scenes that you see where the baseball lands down by my feet, that was half an hour after helping somebody out of a vehicle, and I went home. And I got out of my vehicle, and before I even realized what happened, my son hit me in the chest with a baseball. And it was like I wasn't even there until that baseball made physical contact with me and took me out of the haze I was in. It's powerful what PTSD can do to you. I ended up isolating myself a lot and falling into a really deep depression till the day came back in 2014 where I decided to end my life because people were better off if I wasn't around. That's what I told myself. After the suicide attempt failed, I started looking for help. I started reaching out. I didn't understand what was going on. I Googled my symptoms. On a Google search, I searched for nightmares, flashbacks, anger, everything that was affecting me, the alcohol and the drugs. And when I hit enter a Google search, PTSD filled the screen up. I was upset because nobody talked to me about what PTSD, what the symptoms were until that moment. When I reached out for help, it was really difficult because nobody was, at that time, there for me. It was difficult to reach out for help, and then when my friends, I tried to talk to them about it, they weren't educated on it, and they pulled away and they put their guard up, and I don't blame them because they were just as scared as I was. When I finally did find help, I went and did something called EMDR, eye movement desensitization reprocessing. And once I started getting the therapy I needed, life turned around. I started seeing colors again. See, my world was black and white before, and it was all negative, nothing positive in it. I couldn't see positives or color. And when I started seeing color, I started feeling alive again inside. I had a peace inside after my therapies. And I felt a lot younger and happier, and I was dealing with my problems in a different way. I was starting to debrief and talk about the things that I had stuffed way back in my head from the things I've seen. And once I started talking about it, I could replace those bad images with new images and good, happy thoughts. And life changed a lot. I can see the outside, I can see the beauty outside, I can see people's faces again. I can feel my emotions, I can feel love. I didn't have that before. I was numb. PTSD isn't just a military thing. It affects first responders, it affects nurses, it can even affect an 8-year-old that's seen some traumatic events. You can get it from a car accident, you can get it from one incident, or you can get it from many, many incidents building up into one. The basket gets full sometimes and you have to talk about it. There's therapy for PTSD. There's a way out. There's hope. If you're having some of these symptoms, you know, the anger, the depression, the isolation, depression, anxiety, seek help. Reach out, get some help. It's not too uncommon. There's a lot of people that have depression, PTSD, and anxiety. You're not alone. It's the best thing I ever did was reach out for help and got all my demons out of my head that were telling me how bad I was and that things were my fault. I now go around trying to reach as many people as I can by speaking out. I've got a strength I've never had before, and life is awesome again. Every day that you don't reach out for help is another day that you're in the darkness that you don't need to be in.
When we talk about what is a traumatic event, I find it really important to talk with the people that I work with about the fact that a traumatic event is really defined by the person that experiences it. So what we look at really is the symptoms that arise or maybe don't arise after the traumatic event happens, more so than what the event was for the person. Some folks might go through a traumatic event and not develop symptoms, whereas others might with that same issue. And so what we look at is, how does this affect you after you've walked through this? Many times we think it's related just to military experiences. However, what we know a traumatic event could be are many different things. It could be the engagement in the material that you work with every day, such as first responders, nurses, social workers. It could be a natural disaster. It could be an illness. It could be interpersonal violence. It could be abuse or neglect. It could be many different things that a person might experience through their life. And what we look at is, how did this resonate with you? What was the effect? How is this experience affecting your day-to-day living? And then we go from there. The way that trauma intersects mental wellness, and I would probably say, I really like to work in a holistic way, so just in wellness in general, is that trauma impacts pretty much all domains of a person's experience. So their relationships, their experience at work, their experience at school, if they're a young person, the way they interact with the world in general, whether those are people that they know or don't know, it really impedes their ability to do that well on a daily basis. What some folks might find after a life-disturbing event or over chronic or complex trauma is they might find that they have flashbacks or intrusive memories, frequent nightmares or disturbing dreams at night. And because of the impact of those things, many people will be really avoidant of people, places, or things that might remind them of their trauma. And so they do everything in their power to try to avoid those things that could give them a trauma reminder, that could launch them into a flashback or an intrusive memory or some sort of difficulty that way. What folks will also find is that they have a shift in how they look at themselves in the world. So it's not uncommon for people with trauma to blame themselves or carry responsibility for the trauma happening. They might start to see the world as unsafe, even their loved ones and people they've known for a very long time. They might have a really hard time trusting in those relationships now. They might find that they're disengaged or detached from relationship. They might find that it's hard to remember significant parts of the trauma that they've experienced, and so they might have some gaps in their memory around that experience. They might find that it's hard to fall asleep at night. Increased irritability or anger, difficulty concentrating. They might find that they're hypervigilant, and so they're always looking out for danger around every corner. Their startle response might be different, and so when they hear a loud noise or a bang, they might jump a lot easier than they used to. Those are some of the common themes or symptoms someone might experience when they've had a trauma. It's really interesting as you start looking at the brain science of what happens for someone that has trauma. And what we know is that in the throes of a flashback or an intrusive memory, their visual cortex is activated, and so they're actually seeing that event unfold again in their mind's eye. the part of the brain that grounds a person in time and space is not activated, and so they feel like they're there again, like they're actually reliving that experience again. And it's described as like this time that stretches out forever, so they feel like they're going to be in that moment forever and it's not going to end for them. The other part of the brain, called the Broca's area, that's responsible for communicating an emotional experience, is shut down as well, or limited or impaired, and so it's hard to describe what's happening. They have a hard time describing that emotional experience. And in that flashback, the brain also activates that fight, flight, or freeze response again, and so they may have an increased heart rate, their breathing rate's going to change, their muscles are going to prepare themselves to fight or flight or freeze. And so they have a whole physiological arousal with their nervous system. I think the way that we identify when trauma is becoming an issue for me is I start to see that impacting my day-to-day living experiences. I find myself pulling away from loved ones. I find myself having difficulty trusting others, even those that I would normally have no problem trusting. I'm having intrusive things like flashbacks or memories or nightmares. I'm seeing a shift in my mood, and I'm seeing a shift in how I interact and view the world. Those would be some significant things that I would say are some markers for concern. I think there's a belief in our culture that time heals all things, and with trauma we just know that that's not necessarily the case. And so if we're identifying a shift in our loved one that's significant, it's important that we talk to them about what are the concerns that we're seeing in our day-to-day interaction with them. Sometimes it feels like this trauma thing is going to last forever. And I want you to know you're not alone, that that's a really common experience, especially when we start looking at the brain science of what happens with trauma. And so it's not uncommon for folks to feel depression and hopeless, that this thing's not going to ever end, and is this going to be the rest of my life? And I want you to know that you've made it through 100% of your worst days. And I want you to know that there's a caring professional and there's a caring network out there for you that wants to help you feel better and wants to help you in your recovery. I think one of the hallmarks to trauma is avoidance. And so thinking about coming in and talking to some random stranger you don't know about these really difficult things you've experienced in your life is hard. And I want to normalize that for you. I want you to know that that's okay. And I want you to know that you're going to feel really powerful feelings around not wanting to do that. And I want you to know there's a lot of tools and techniques and trained folks out there that can help you manage that and navigate that in a way that you can get back to your life and you can feel good again, you know, living in the way that you deserve to live. What I really like to recommend to folks is two things. One is find a therapist that you feel comfortable with, because the work of trauma work is really tough, and if you're really not resonating or engaged with your therapist, it can make it even more difficult. So find someone that you fit with, and I think that's a really important part of the equation. I think the other thing is not every evidence-based practice is going to be a great fit for every person either. So talk with your therapist about what makes sense, and talk about your options and get your options, and then find the one that works for you. A couple options to treat trauma are EMDR, which stands for eye movement desensitization and reprocessing, and TFCBT, which stands for trauma-focused cognitive behavioral therapy. EMDR is an 8-phase integrative trauma treatment. It's an evidence-based practice. It is a trauma treatment that, through the use of eye movements or other tools that we have, it helps facilitate the brain's ability to reprocess and integrate information that's been stored dysfunctionally. Trauma memories aren't encoded in the same way that a non-trauma memory is, and so it's chunked up, it's fragmented, it's disintegrated. And EMDR helps the brain to reintegrate and reprocess that information in a way that helps reduce the bodily sensations that a person feels when they feel activated by trauma. It helps to limit or desensitize the yuck that comes with remembering that trauma. It helps to increase self-worth and self-esteem. And it helps to create meaning and we are meaning-making creatures, and trauma really disrupts the ability for folks to make meaning in their life. And so EMDR helps to facilitate that process of healing. What EMDR looks like is someone would follow my fingers back and forth for a set amount of time or a certain amount of sets. Then I have them take a break, they take a deep breath in, and then I ask them, well, what are you noticing now? And they report what they're noticing, and then I tell them, all right, go with that. And we start another set of eye movements. There are many ideas or thoughts about why EMDR works. Some of the prevailing ideas are that EMDR helps to replicate REM sleep in the brain, and REM sleep is that time of our sleep pattern where our brain's going through the information for the day and categorizing it and putting it in our file cabinet of our brain. The other idea is that EMDR promotes a reciprocal inhibition. And essentially what that means is that we're taking or having someone sit with that trauma material, which is activating for them, and their nervous system's in high alert. And in the process of following my hand movements back and forth, it's creating a relaxation response for them in this moment. Helps them stay grounded in this moment, and it helps them remind themselves that I'm safe, and I'm safe in this present moment. And the brain's ability to let down and feel safe allows that person to start processing and working through the material. It helps the brain to reintegrate and work through that piece in a way that can be helpful for them. Trauma-focused cognitive behavioral therapy is an evidence-based practice for young people. It's for those aged 18 and younger. It's a model that pairs the power of cognitive behavioral therapy and a trauma-focused model. So young people start out by doing an assessment on their trauma and what they've experienced. We assess their level of trauma and what they've experienced. And then they go into a model with the practice acronym. And what practice stands for, P stands for psychoeducation. So we talk about what is trauma and how does it affect my day-to-day experience. We then go into relaxation, which is we talk about different things to help relax the body, because there's a lot of physiological arousal that happens in trauma. We next talk about affect modulation. So how do I regulate my emotions when I'm activated? What would that look like? We talk about cognitive coping, which is the power of that CBT model of thoughts, feelings, and actions. We then go into what's called the trauma narrative. And that's where we look at and explore the trauma experience for that young person. And they create their own book. And they write a story about their narrative. And we work through the trauma parts in that narrative together. We do in vivo desensitization if that's necessary, where we help desensitize certain aspects of the trauma. We do what's called a conjoint witness, and part of the power of this model is we work with a caregiver or someone close to them in conjunction with the young person. And they read their story to this person, and they work through it with this person, and this person is a cheerleader and a support and there to help them, guide them along the way. And then we end with enhancing resilience or enhancing safety. And what we know about people that have experienced trauma is that they're at a higher rate of re-experiencing trauma. And so we talk a lot about, okay, I've learned all this stuff. I've made some good meaning out of my experience and I'm moving forward in a healthy way. How do I keep myself safe and how do I keep myself moving forward in a great way? The way that we encourage people to get help can feel kind of scary, I think. And I think a lot of times in our world we feel like we have to have the right thing to say or the right thing to do before we do what we need to do. And I would come back to the thought that some of the most powerful tools we have as human beings are compassion and empathy. And I think if we can meet someone with compassion and empathy and say, hey, I love you and I care about you and these are some of the things I'm seeing. What do you think? I'm here to help. I'm here to listen. I'm not going to have all the right words, but I don't have to, and that's okay. And I want to help you see yourself feel better. I want to see you get better. Ways that we can relate to our loved ones when they've had an experience of trauma and going through their recovery journey are a fewfold. I think a really important part of walking this journey with someone is just getting your own education What is post-traumatic stress? What are the common signs and symptoms? What are the concerns? How might a person react in certain ways, and what can be expected or what is common? And then applying that knowledge to your loved one, because what we know is post-traumatic stress isn't going to look the same in every individual. And so we do our best to get some information about what does this look like, what does this mean, what's happening in the brain for them. And that gives us an explanation about what's happening in front of us and gives us some idea of what we can do to respond to them and respond well to them. I think another thing that really helps when we're in any sort of caregiving role, no matter what amount that might be for you, is getting your own support. You know, how do I keep myself full? How do I keep my cup full so that I can be that support and that cheerleader for that person that I love? And then continuing to have that conversation about, hey, I'm here for you, I'm here to listen for you. Letting empathy and love really drive your interaction with them, and not having to worry about the right thing to say or the right thing to do. But just letting them know, hey, I'm a phone call away, or, you know, come stop by for some coffee and let's hang out. I care about you. I love giving people good news. And what I have to say is there absolutely is hope for someone with trauma. I have the honor and the privilege of walking alongside people in their recovery journey. And it's just so great to see what can happen when they put themselves into the process and work through this thing. And there's so much hope for you. So much hope.